Empanelment is the process of linking patients and their families to primary care providers and care teams. It is the key to developing continuity of care and is the foundation for population health management. Ideally, every patient in a practice is empaneled with a primary care provider and with a care team. Panel assignment should take into account patient preferences and family structures. In some practices, empanelment will need to attend to demographic variables like age and gender to ensure that providers have the opportunity to care for a broad range of patients. Empaneling patients according to demographic factors like language, ethnicity, and race can improve language and cultural concordance with providers and team members. In an optimally empaneled clinic, every patient is partnered with a primary care provider and a care team. The clinic leadership regularly reviews provider and team panel sizes to ensure a balance so that clinicians do not have panels that are too large or too small. In residency clinics, panels need to be transferred every year as residents graduate. It is critical to ensure that patients don't get lost in these transitions, that families remain empaneled together, and that panels are constructed to provide a diverse learning experience. Clinic staff use patient panels to guide scheduling, prioritizing provider continuity and team continuity when scheduling patients. As a preceptor, you can help residents notice the impact of empanelment or its lack in their own practice, bringing the core concept of empanelment to life.
So, based on her polyuria, polydipsia, and fatigue, I think she probably has diabetes. I asked the medical assistant to do a finger stick to confirm, and it was 300. So I'm starting her on metformin. I'll get an A1C, lipid panel, and metabolic panel today, and then set her up with her primary care provider to follow up with the result and add other meds like an ACE inhibitor and statin.
It's great that she dropped into urgent care for these symptoms. It sounds like she hasn't seen a provider in a while, and we're really lucky to have caught the diabetes.
Yeah, you're right. She hasn't actually ever been to our clinic before.
So who's her assigned provider?
Let me check. It's Dr. Garcia.
Isn't Dr. Garcia finishing her third year next month?
That's right.
Given that it's a new diagnosis, it might be good for her to establish care with someone who's able to follow her for a while. One of the key principles of empanelment is that we attend to patient preferences. How about we ask her if she has any other family members that attend our clinic, and if not, if she'd like to follow up with you?
That makes sense. I think you're right that the continuity will make her feel more supported with the new diagnosis.
By helping residents think about and manage their own empanelment, you prepare them to lead effective clinics in the future and provide them with a sense of increased control over their own clinical experience. As a reminder, preceptors can help residents identify their panels in clinic to take note of how panels are weighted and how that can affect clinic flow and clinician time, and encourage residents to think about what factors should be taken into consideration when weighting panels.